Thank you for joining us for another episode of Matters of the Heart. This is a program brought to you by Haverhill Community Television as well as Pentucket Medical Cardiology. My name's Dr. Sunny Srivastava. I'm a cardiologist here in Haverhill, and I'm joined once again by one of my colleagues, Dr. Seth Bilazarian. And we're going to revisit a topic, maybe in a different fashion, but a topic that I think we talk about not infrequently on the show, and that's revolving around diet and how it affects our cardiovascular health, because I think most of our patients and most of the viewing population can agree that what you put into your body probably plays a pretty large role in how you do from a health standpoint. And so more recently in the past, what was it, maybe 3 weeks ago or so, a study was published in a very well-known medical journal, the New England Journal of Medicine, looking at nuts and how it affects your cardiovascular health. And Dr. Bilazarian is going to review that study that was published and talk about it and give us the details and give us an update.
Yeah, well, so thank you. So thank you for that introduction. And so nuts are one of those things that there's been some evidence for some time, or not even as much evidence, but recommendation. In 2003, actually, the FDA concluded after their review of the available data, that's now over 10 years ago, that taking nuts, about 1.5 ounces of nuts, so about a handful of nuts a day, was a beneficial and may reduce the risk of heart disease. So we've had this as a recommendation for some time. One of those things, I think we all recognize that what we eat is really critical to our health and our well-being. There's that expression, you are what you eat, right. And then I think it's fun to say, if you are what you eat, then if you eat nuts, are you nuts? So I think that's the question that is a lighthearted way to look at this. But there's a lot of really decent theory about why nuts might be valuable. They're rich in unsaturated fatty acids and fiber, vitamins, minerals, and other biological substances, something called phytosterols, that are all thought to have theoretical benefits. But we don't like to practice with just theory. We don't like to say, oh, well, that's probably good, so you should drink it or eat it, or all those kinds of things. So we like to rely on data, but it's very difficult to get data about diet because it's not a control thing. You can't tell people, you can only eat this. People are living. So these large epidemiologic studies, like the one we're reviewing today from the November 2013 New England Journal, are epidemiologic studies. So over 100,000 patients, 2/3 women, 1/3 men, were followed for several decades. And every year or two, they had a nutritional survey. So they would sit down and they would fill out, like, how much do you eat this, how much do you eat that, how much do you exercise, do you smoke? So it was a lifestyle epidemiologic study to try to sort this out. And the study, just to skip to the end, for those of us who have to switch to another channel right now, we'll tell them, yes, there was a benefit in this study. But we're going to go into a little bit deeper about what this is all about and what it might mean. But in the past, prior studies have shown that there may be benefits on diabetes, something called a metabolic syndrome, colon cancer, high blood pressure, gallstones, diverticulitis, and even death from inflammatory disease. So there's a lot of sort of enticing things that might say, well, let's eat more nuts. Mm-hmm. But then how much nuts and how do you prepare the nuts? A lot of these things are not answered by this paper. Roasted, salted, raw. A lot of these things we don't have answers on. And again, for those who might cut out on us, I'll just say there's no data that you can just eat nuts and not exercise and eat everything else bad and smoke. We're not saying that. We're saying that in addition to other healthy things, can you actually improve your health further by including nuts in your diet? And I think that is what this trial says. But we're going to go into a little bit greater detail.
And one thing I would add to just the amount of nuts one is eating in a sitting, because there are a lot of calories in nuts and
right.
things. And I had a patient who said to me, well, I eat nuts. And he turns out, these tall bottles, the tall, narrow bottles of Planters, he'd eat in one sitting half. Uh-huh. The next sitting, the other half. Uh-huh. Well, that's a little too much, I think.
Right, so a lot of calories. Yeah. And when you said Planters, I will say that this article did try to make an effort, because just for our audience, I'll review that peanuts are not really nuts. Yeah. So this study tried to look at all nuts, including peanuts, but they actually separate so-called tree nuts like walnuts, almonds, and hazelnuts from the peanuts. And all nuts did help, but peanuts weren't as good as the tree nuts. So I think that would be something that's important just to mention on that.
Did they look at cashew nuts in this?
That was not mentioned in this paper. Right. So that's, I guess, the beginning of what I would say about this. And then just to go forward, I mentioned the numbers, but it's really a phenomenal amount of numbers. So again, as physicians, when we see numbers like this, it gives us encouragement. As much as I said, on one hand, it's hard to do these studies and you're not sure. they had actually 76,464 women and 42,498 men. So over 100,000 men and women and were followed for decades in this study. So it was really a pretty remarkable event. So the reason why we like it is the bigger the numbers of patients, the more confident you can be in the trial.
And this is something called the Nurses' Health Study, correct?
Well, that was the women's part, and the men who participated were from the health professionals follow-up study.
Okay. Yeah.
So that were the two big studies, yes. So the one thing I'll just make mention of is that I am not an epidemiologic expert. An epidemiologist is somebody who looks at large statistics about health and tries to make interpretations about it. But one thing that we are cautioned about when we look at these epidemiologic studies is something called confounding. So I just teach the audience a little bit about it, and I ask you to remember what you learned about confounding in medical school. But the story that's told that I recall, one of those few tidbits of information about epidemiology that I remembered from medical school, is that if you looked at people who have matches in their pocket, you will find that that population of people who have matches in their pocket have much higher rates of lung cancer. So should we conclude that matches cause lung cancer? And of course, that's that thing that helps highlight and understand confounding. No, we of course know that the reason why people carry matches in their pocket is because they are smoking cigarettes and they need the matches to light the cigarettes, and cigarettes cause lung cancer. So we have to be very careful that what's just a marker of an issue and what is really a cause and effect. And the authors of the study do say that with caution, we can't really say whether this is cause and effect. And one of the things I tell my patients is that one of the things that might be good about something like nuts is that if you're eating nuts, you may not be snacking on other unhealthy things like pretzels or chips that probably have less nutrient value than nuts do. So part of the good thing about nuts might be not eating other things. But then as a clinician counseling my patient, who cares? If it may not be from the goodness of the nuts, it may be from the not taking the bad things.
Yeah, either way, it's a win.
Either way, it's a win.
Yeah.
So part of this as a physician in the community trying to interpret this data for my patients is, yes, I'm not sure it's cause and effect, but it may help as an added value to health. Any thoughts about confounding?
No, but I think that, well, yes, that many studies like this, these observational studies are riddled with confounding factors. So you have to take it with a grain of salt, so to speak. But I am very eager to hear what the results were, because it's something that I've talked about a lot with patients and promoted and advocated for. So what did it show?
So, well, before that, we'll just mention one of the confounders. So one of the things, again, it might be that people who have a tendency to eat nuts are healthier, because what the study showed was that the patients who consume nuts were more often leaner, less overweight, they were less likely to smoke, they were more likely to exercise, they were more likely to use multivitamins, they consumed more fruits and vegetables, and they drank more alcohol. So some of those things, might be added benefit or not. But what the epidemiology, biostatisticians, the people who actually do this work to do it, is they will actually take out these different things. So they'll only look at people who don't smoke, or only look at people who do smoke, to try to sort out those confounders. Mm-hmm. But there may be confounders that we don't even know, for instance. So it's hard to say about that. But I just want to share it. So then you asked for the take-home message. The take-home message briefly is that this did have an effect broadly in a variety of different health issues. There was a significant inverse association. And what we mean when we say inverse association, if something's associated, the more you do that thing, the more the disease you have. So that's an association, and inverse is the opposite. So the more you do that thing, the less disease you have. So an inverse association was seen with this. So the more nuts that were eaten, the less likely that we saw patients had these disease entities. And they divided people into never having nuts, less than once a week, 2 to 4 times a week, 5 or 6 times a week, or 7 or more times a week. And the people that were never or less than once a week, in many ways were the same, but even less than once a week patients seem to have a decrease in many of these issues, many of the issues related to health concerns. And the study the one part of the paper that looks at this looks at a variety of things, and we call it a whisper plot. It looks at if it's better to do the thing, it's on one side of the line, if it's worse on the other side of the line. So it's better to have nuts for cancer, heart disease, respiratory disease, neurodegenerative diseases, stroke, infection, kidney disease, diabetes, and other stuff, so other causes. So some of those weren't as strong associations. We have sort of a statistical way to look at it.
What were the strongest
associations? The strongest associations, the ones that don't cross the line, seem to be related to issues like cancer seems to be to the left of the line. Respiratory diseases seem to be across the line. But the other things seem to be sort of, trending towards nuts, but not, frankly, across the line. Your thoughts about any of that?
No, I find it fascinating. And this was nuts including peanuts as well?
So what you see in our paper here is they said all nuts include peanuts, then they have peanuts, and then they have tree nuts. So that's how they distinguished it. And you can see there's a little bit stronger associations for tree nuts on almost everything than there was for peanuts. So I think that, and again, so maybe that speaks to that issue that I said earlier, that peanuts may not be as good as a nutrient, but if you eat peanuts, you're not eating chips or pretzels. So perhaps that's the idea behiin that.
And what was the amount? Just like a handful they're talking about.
1.5 ounces was considered the serving. So that's I think is a fair estimate, is about a handful.
Got it.
So this is, again, adding to our level of ideas here that, there's been several trials in the past that have shown that eating nuts may reduce the death rate by 20%, and may, as I said, mentioned reduction from some of the things that were added in this trial. But again, heart disease, cancer, respiratory diseases are all things that were contributed to a reduction in death. But as I mentioned, there are many unknowns here. And I think that, again, for those of us for those of our members of our audience who may sort of just want to get the quick take home, I think that the message here again is that this seems to be a really valuable addition to a diet, but I think that it can't overtake negative health things like smoking, lack of exercise, and being frankly overweight. That there's no way would this suggest that that would be a value.
So you're saying that if I'm a smoker, just grabbing a handful of nuts a day is not going to trump the smoking or negate it?
I mean, obviously I don't have conclusive evidence that that's the case, but I think that would be a really dangerous thing for people to take away from our program today. So I think that I mentioned earlier that salted, spiced, roasted, or raw, we don't have any data. That was not evaluated in this study. So is that a difference? I think there are many people who have the concept about so-called a macrobiotic approach, that the more unrefined or raw foods are better for us. So certainly that's the case. I think that we all also recognize that more salt, so a heavily salted nut, might be a detriment to this benefit. So there are some take-home messages.
What about something like peanut butter, for example?
Yeah, I don't know about the answer to that, and I don't even know how that was addressed. I mean, there are other nut butters even. People now, almond butter and cashew butter are available for people. So I think those are, I don't know. I would presume that might be equivalently beneficial.
Yeah, I think the downside with many peanut butters, it all depends on what you're buying. There's some that you buy, and the first ingredient you see is
sugar.
Sugar or corn syrup or something, or high fructose corn syrup or something, where versus buying a natural peanut butter. So I think that's where the difference. I'm guessing. I don't know for a fact, but I'm guessing that that's where some difference lies. Buying a natural peanut butter versus one of these processed types.
Yeah. So I think that. I would think that that's the sort of main message, and I agree with you. I think that's certainly a strong caution. I think that the processed foods, probably one of the reasons why, in general, less processed is better than more processed, because I think many people in the public aren't savvy enough to be cautious. But when you ask the question, I was thinking a pure peanut butter or a pure almond butter or a pure cashew butter, theoretically, from my standpoint, would probably be equivalent. But you're certainly right, with additives and many of the processed peanut butter products, I guess I would say, it's sort of like a juice that is really only part juice and has corn syrup, probably really loses a lot of the benefit.
Actually, it might be hurtful too as well.
Yes, I agree.
It's funny, as you were talking, I was thinking about how, boy, I'd love to have my kids bring nuts to school for their snack more often, and they go to pack their lunches, but I think they're not even allowed to.
Are nuts? I mean, I know that there's a very strong prohibition about peanuts because there's such a high prevalence of serious peanut allergies in our schools. Is that the case for other nuts?
It's funny. I don't know. Just anecdotally talking to other parents and with their kids, I hear people talk about, well, he has tree nut allergies. So it's more diverse than just peanut, but I think peanut still is #1 out there.
Okay. And obviously that would have an impact. I mean, obviously families would have difficulty having nuts in the home if one of the family members...
It really is quite amazing, the prevalence of the peanut allergy. That's a whole topic for another discussion.
Yes.
Another day.
I think that we've fairly discussed this topic today, summarizing again a New England Journal article from November 2013, which was an enormously large epidemiologic study looking at dietary history in the nurse's heart study and the the health professionals follow-up study, looking over decades, and found that with nut consumption, there seemed to be a significant benefit in multiple disease entities in reducing the disease prevalence if there was a greater consumption. And that consumption seemed to be even with taking it less than once a week, but there seemed to be greater benefit with 1 to 2 to 4 times per week. And we're talking about a dose, so to speak, with nuts, about a handful, 1.5 ounces. So I think that this, in many ways, in my mind, just as another thing that sort of adds to the 2003, now 10-year-old recommendation from FDA that there may be a benefit on heart disease. I don't think we can go any further than that, but adding the nuts, and I guess I would add a personal reflection. I don't know what your thoughts are. I think that we've talked about it. I should say I do know it, but share with the audience that you and I both share that when we take a handful of nuts, that it is an appetite suppressant. They're quite filling. They actually taste great. They're actually quite satisfying. And I do find that I don't often seek other foods when I do.
Yeah, so it's fine. As an anecdote, I run for exercise quite often. And what I usually do, unless I'm running really early in the morning, but sometimes on the weekends I'll run later. When I get back from my run, the first thing I grab some water, and the first thing I do is I grab a handful of nuts. Because I'm usually really hungry after a long run. And I'll grab a handful of nuts and eat them right then and there. And that satiates me for a while. And I don't start grabbing. In the past, I've been prone to grabbing junk, whatever I could find. You know, I was so hungry after a long run, I would eat a lot of garbage. And it makes a difference. Just eating that handful of nuts after a long run keeps me satiated. I used to think years ago, run, I earned a right to eat whatever I want to eat. I would eat, just junk, and that doesn't work. That's not a good strategy.
All right.
So we are starting to run out of time, but thank you for going through. I think this is a topic, actually, quite frankly, that a lot of our patients find very interesting. I talk about it a lot. We get asked questions a lot about diet and what changes one could make. I know we've talked about this periodically over the years on this series. But when there's something new, it's always nice to refresh memories and talk about new data and new studies. And so I think the take-home point would be just what you said, that adding nuts to a small amount, a handful of nuts to your diet several days per week, if not every day per week, is a very nice and reasonable strategy to complement a heart-healthy diet. It's one, just my last plug, that when people talk about the Mediterranean diet as an optimal heart-healthy diet, that nuts are an integral part of that as well. So with that, we'll wrap up here. So thank you for this nice review of this recent article.
If I may, I just would say to our audience before you can close, is those who like internet resources, the New England Journal website, you can find this by Googling NEJM, which is New England Journal of Medicine, nuts and quick take, has a very nice short video that summarizes this article for our lay public.
Oh, good, great. So thank you for that review, and this is wrapping up another episode of Matters of the Heart. It was brought to you by Haverhill Community Television as well as Pentucket Medical Cardiology. Thank you and have a good night.